I am the proud executive director of Urban Neighborhood Initiatives, as well as a really proud partner of this coalition. And most importantly, a mom of three. We are really excited about the town hall today. But remember, this is not just us talking at you. We want to hear from you as well. So if you have comments or questions, please put them in the chat. We've got, I think, Lindsay and Amy and Ophelia moderating the Facebook chat, and they are waiting to hear from you. So let's make sure that they're on their toes and let us know how you heard about the town hall today. And I am going to pass it over to my co-moderator, Miss Jametta Lilly. Jametta?
Hello. Hi, Christine. Thanks for passing the baton. For those of us watching the Olympics, we know how important it is to pass the baton. My name is Jametta Lilly, and I am blessed to serve as the CEO of the Detroit Parent Network, and I am a proud member of this COVID coalition that has been bringing information that gives you health, education, basic needs, and social justice information so that our community stays informed and stays powerful. We want to make sure, as was said, that we are making sure that everyone can participate in this. And we're converting as we speak right now into ASL as well as Spanish. For all of our speakers that will be joining us, please make sure that you slow down enough so that our translation can occur. Got a couple of things that we know are really important to emphasize. The Community Coalition for Youth and Families is saying to all of us how important it is that all of us wear a mask and that we get vaccinated, because our goal is to make sure that our community is safe and thriving. And we are still in the midst of not only this pandemic, but it is developing even more and growing. So again, we are asking you, please make sure that you get vaccinated. And no matter where you go, that you mask up. And what an appropriate time for me to make a transition. So I'm going to transition now from that affirming how important it is to get vaccinated, to be masked up, to Rajeshri Bhatia, our other co-moderator, because we're getting ready to hear from the health department as we talk about our realities of COVID. Rajeshri, how are you? Welcome.
Hi, thanks so much. It's great to be here. And I'm doing great. Just washed all my masks this morning, so I'm ready to face the world. Would love to welcome Ms. Tanea Hackney. So Tanea, if you want to turn on your camera and microphone, welcome back. We're so happy to have you.
Hello, hello, hello. It's always good to be here.
Great. So we have a bunch of questions, but I wanted to first, if you have a slide or two, you're welcome to share that. Otherwise, I'll jump right into our questions.
Okay. I can, because you know I always love to give data. So I will share just a little bit, and I do have some questions as well. And some of these may be answered with the slides. So let's see here. I'm going to share. Let me get my full screen going here. Share screen.
Yeah, briefly before you share, I'm going to invite Ophelia on to just tell us about translation and where we can get translation.
Okay.
Ophelia, do you want to tell folks where we can get translation?
Sí, buenas tardes. Si gustan ver este video en español o escucharlo, por favor vean el chat o vean nuestro sitio de Detroit Hispanic Development Corporation. Y ahí estamos ahorita transmitiendo esta traducción e interpretación en vivo. Y hoy la traducción sería hecha por mí, por Ofelia Torres. Muchas gracias.
Katie, can you tell us about ASL? All right, go ahead, Rajeshri.
Thank you so much, Molly, for those important updates. And thank you to our translators. As a reminder to everyone, our translators are working super hard to make sure that they convey exactly what is said. So we just ask all of our speakers to speak slowly and clearly so that they can make sure they get the translations correct. All right, Nurse Hackney, my apologies. Let's jump right back into it. You had some great slides to share with us. Go for it.
Awesome. Thank you for that. That's always needed because we want to make sure the whole community gets access to all the information that we have. So I'm going to go back and share my screen. There we are. Okay, so some updates that we have. Of course, we're always going to start off with our numbers. So the positivity rates, if we look at July 24th through the 30th, our numbers have increased slightly. St. Clair Shores, 5%. And these numbers, I would say just over a week or two ago was half of this. Michigan altogether was at I think it was 2.9. So yeah, our numbers are climbing. As of August the 8th, we're still having over 52,000 confirmed positive cases. Our deaths have increased to 2,300. And then we're going to look at our vaccination rates. So right now, Detroit is 40.1% vaccinated, and that means with at least one dose. Macomb County, 57, Oakland, 68, Outer Wayne, Washtenaw, all in the 60s. These numbers are really good. Detroit, we have to do a little bit better. And that's why the Detroit Health Department wants to be in front of you, wants to be visible, so we can educate to prevent the hesitancy, so we can answer the questions, so we can give the right information, and also give you the ways to prevent the positivity rates from increasing. The whole state of Michigan is 58.1%. So if we look at our future doses that are scheduled, right now we have over 1,000 that is scheduled, and that's all the way until the end of August. You don't have to schedule to get a vaccine, but this is a better number than what we were seeing. It was in the hundreds. So we do have some scheduled, but any site is a walk-up site. If you decide today you want to get vaccinated, you can walk up to that site and ask to get vaccinated. You don't have to schedule. So that's our data. We also, some of the questions that you sent over asked about Delta. The slides, what we are talking about now, because Delta is very important to talk about. So the variants is changed, they mutated, which is why we're talking about this variant Delta. Delta is spreading easier, it's more contagious. So we're asking people to mask. And who should, well, why should we talk about this? Because Detroit, again, we have to go back to the data, is only 40.1% vaccinated. So if you're not going to get vaccinated, because we definitely, Detroit Health Department encourages vaccination. If you choose not to get vaccinated, wear a mask indoors, outdoors, because the variant of Delta is very contagious. It's highly transmittable, and those that are vaccinated are getting this variant, but they're not having the extreme side effects of having to go to the hospital and having, and it's preventing death. And that's the number one goal of getting vaccinated and preventing this COVID from spreading. So if we look at the level of community transmission, all the red, that's high. This is Delta, and over 80% of all positive cases are Delta right now. If you look at the map, you see even Detroit right now, we're moderate right now, yes. But if we don't mask, if we I know it's hard to put those masks back on, but if we do not, we're going to be red just like these other states. So the CDC recommends masking based on the Delta information that we now have, because the transmission rate, again, is highly transmittable, highly contagious. So in the state of Michigan and the city of Detroit, we are experiencing transmission rates. They are not extremely high right now, but they are climbing. So we're encouraging vaccinations. We're encouraging mask wearing. We're encouraging hand hygiene, social distancing. This, we're going to keep this going until we can get back these numbers. We can get back to somewhat normalcy. We won't get there until we get vaccinated. That's going to be the most important things. Those that cannot get vaccinated, masks. We're going to have to wear masks right now. Are the vaccines effective? Yes. Getting vaccinated prevents severe illness, hospitalization, and death. That's the number one for vaccinated, unvaccinated. Who's eligible for vaccines? This is the most important part again, because we're talking about going back to school. We'll talk about a little bit of that in just a minute. Anyone 12 years and up is eligible for vaccinations. You'll get a Pfizer if you're 12 to 17. If you're 18 to and up, you can choose to do Johnson & Johnson and Moderna, or Pfizer too. But anyone in the city of Detroit who works in the city, who has a caregiver or carers for anyone in the city, you can come and get your vaccine. We're giving out vaccines. There's no price. You can walk up. We have a lot of sites. Just come. We even have the homebound program. And all of these can be accessed, scheduled, transportation. You can also do COVID testing, because we want to encourage that, because again, with this Delta variant, you can get positive. So it's important for businesses, organizations, schools to promote COVID testing again. So if you need COVID testing, transportation for vaccination, homebound program, you want to register for that Good Neighbor program and get $50 per person that you bring to get vaccinated. As long as you register, you can do all of that at this number here, 313-230-0505. Again, there's plenty of locations here from 9 a.m. to 7 p.m. because we have people that work a lot of different hours. This is not the only locations we have. And because of that, you can call the 313-230-0505 and you can get other locations. You can get other locations for COVID testing, PCR tests, COVID information. And I'm going to leave it off here. I am going to copy and paste this information so that it's given, because we want to be able to be, again, visible to the city of Detroit. We also have our community nurse line. The number is 876-4000. It's option number 3. You'll get a nurse from 8 a.m. to 6 p.m. You have a question, still hesitant, let's talk. If you need to request a copy of your COVID vaccine, people have lost cards, you want to call the Detroit Health Department Vaccination Clinic to get a replacement of your COVID vaccinations. That's going to give you a list of all of your vaccines, including COVID. That number is 313-876-4667. There are instructions for that. Press option 2, then press 2 again. If they don't answer, leave a voicemail. Everyone's losing their card. they'll call you back. So I'm ready to answer questions. I have a few already that you sent me, but I'm ready.
Okay. Well, you answered a lot of the questions that we had through your presentation. So thank you so much.
No
I think
problem.
one of the questions that we have is just sort of practical life, right? If we are, living our daily life, what should we be doing? Should we be staying home at this point? What do we do if we want to go out? What's your best advice to folks who are just looking to, live their lives and not get sick?
Exactly. Well, you can always, my suggestion, you want to go on vacation, see how you want to call ahead, see who's there, how many people are there. If it's overcrowded, if they're busy, very busy, because anytime you Google, if you use Google for a location, it'll tell you if that business is busy, low. You can use that. If it's really busy, stay home.
Yeah.
If it's okay, moderate, definitely wear a mask. If you're going in public around people, wear a mask, whether you're vaccinated, unvaccinated.
Okay. So mask up and play the numbers. Be smart about it.
Social distance.
Social distancing. Absolutely. Great. Okay. So yesterday we read that the governor and Dr. Calhoun recommended masks for kids in schools.
Yes.
So tell us a little bit about how your department will be collaborating with schools as they, make their policies for students in class. What resources do you have to help schools?
Thank you for that question. That's a very good question. We're working with the Detroit Health Department, with the DPSCD right now, form town halls to return back to school. That will include town halls for the youth, information for parents and the staff, and what that will look like for the staff to help with those policies. It'll include promoting vaccination, mask wearing, physical distancing, screen testing, ventilation, hand washing, and staying home if you're sick.
Such an important one, that last one that you said, staying home if you're sick. I think that's one of the key messages we've received through this pandemic is a lot of us tried to push our limits.
Yes.
And now we recognize how important it is to stay home when we're sick.
Yeah.
Okay, so what do you think? There's been a vaccination mandate in New York City. You think Detroit's headed that direction?
I certainly hope not. I hope not. I did hear that some businesses have already mandated, and they can, for customers to come in to either show your vaccination card, to have a test result before you enter that business. And that's totally okay for them. The city of Detroit, I hope we don't get there. If we can all come together and get this number up, but right now we're only 40.1%. It may. I don't know. I hope not.
All right. And then we do have some questions from the audience, but the last question I'm going to ask you is, again, just more of a protocol / how your department can support now businesses. What should businesses do or organizations do if they have a positive staff member? What are the safety protocols and how are you communicating those protocols besides just putting it on your website? So if I'm running a business or an organization in Detroit, how do I know what to do if we have somebody test positive in our organization?
Okay, that's always a good question also, because CDC and the governor want us to come back to work. So we've been rolling out policies and a plan for giving those organizations and workplaces information or help guidelines to build that policy. with that, we're talking about COVID testing, the same information that we're talking about with schools, promoting vaccines, mask wearing, physical distancing, ventilation, hand hygiene, all that's important. And also keeping those, encouraging those that feel sick to stay home. With the businesses also, we're also trying to come up with a plan, because who's vaccinated and unvaccinated? How do you show that? That's the other part of the plan and what it looks like.
Okay, great. Thank you so much, Nurse Hackney. I'm going to pass it off to my co-host, Christine Bell, who's got a couple of questions for you as well, but always a pleasure to have you. We will see you very soon. Christine?
Thank you.
Thanks, Rajeshri. Hi, how are you?
Good. How are you, Ms. Bell?
Good. So one of the questions is about translation. So are there bilingual nurses on the nurse line?
Definitely. Well, not on the nurse line, but we do have a bilingual specialist. Her name is Anna, and she's amazing. If you call the nurses line, all you have to do is say, hey, I need a bilingual specialist. We'll call her right then. She'll call you or she'll say, and she has made her number public. So she's ready. She's always available. And again, she's just awesome.
So I know Anna, and I love her dearly. So
Yes.
She is a very kind, wonderful person. And I'm glad she's made her phone number public. Is it possible for you to share her number? Because my other question, to just follow that up, is if someone's bilingual, could they call Anna first, and then could Anna tap into the nurse's line?
Well, what we do, when I share my information, her number's already there.
Okay.
So when I share it in the chat, that can be given to anyone.
Okay.
So they don't have to call the nurse's line. If Anna has any nurse questions, she can call us. She has our number directly. We do direct communication, and we can answer the questions, and she can translate.
Great.
Whatever we have to do to get the information there.
Great. So before you go, if you can drop that number in the chat so that we can share it in the Facebook chat, that would be wonderful. And you had said that you're creating some guidelines for businesses right now. When can businesses expect to see them, and where are they going to be mailed to the businesses in the city, or are they going to be on the website? Where might we find them?
So we've already been talking to businesses. We've formulated guidelines, I would say a month or so ago, and have been talking to different businesses, going out to different businesses, educating, promoting what we're talking about right now, the vaccines, and having a vaccine clinic right there, or nurses to give the vaccines. So anyone with an organization, a business who needs education, who wants to set that up, go to detroitmi.gov, and there's a link on there to request a vaccination event, and let's make it happen.
Great.
That's what we're doing. We're trying to be visible as the Detroit Health Department. Perfect.
So you heard it here, everyone. If you're a business and you want the health department to come and do education and help answer employees' questions, you didn't say that, but it sounds like that's what you're doing. Mm-hmm. And set up a vaccination event for your employees. You can do that by going to the health department's website and requesting to schedule an event. That is such wonderful information. Like always, it is such a pleasure to have you and to give us the most up-to-date information. You have a wonderful rest of the week, and we will see you next week.
Thank you, guys.
Thank you. I'm gonna pass it back to Miss Jametta Lilly. Jametta.
Hey, thank you so much, Tanea. And it's exciting to hear as an employer that you are willing to come out and have conversations as we are all trying to navigate, right? Christine and many of us navigate having a safe workplace. While we are absolutely advancing, get vaccinated, we may have some people that are still hesitant and on the path towards getting vaccinated, but how do we make sure that we're safe? So you're going to be hearing from us, in fact. Thank
You know
you so
what?
much.
That's so awesome. Thank you. And also, we have a program, Train the Trainer, to train businesses to educate as well. If you have a person or two that we can train, we can do that.
Tanea,
you-
please get that information to us because
Yes.
those of us that are partnering, for example, DPN partners with Wayne Health and our family health advocates are happy to share that information wherever we go because we're all in this together. Doesn't matter where you work or what institution pays your check. It's about keeping our community safe.
Community,
and
the
trying
city
to
of Detroit. Yes.
Thank you.
And also,
Thank you.
we have to include our behavioral specialists because of depression, anxiety. That's included with COVID. That's important to mention.
Yeah, because last we looked, it's physical and mental health. We're all in one body.
Yes.
Our heads are not cut off from the rest of us. Thanks so much. And speaking of how do we integrate our lives, we know that education has been essential during this time period. And just like we are always trying to provide information, we want to now move into a segment that we're really very pleased to be able to offer. And that is a focus on back to school. It's around the corner. And we have two of our leaders from the charter community, as well as from the Detroit Public School Community District. And not only do we have leaders from our schools with us, but we have parents and a youth that know what it's like to be a recipient of those services. So joining us in this back to school segment, we have Yolanda Eddings. Welcome, Yolanda, who is the Director of Community and Parent Affairs for New Paradigm for Education.
It won't let me take the camera off, so someone has to do it on your end.
Oh, okay. So if someone can do that, let's make sure that we can see Yolanda's wonderful glow. The other expert will be joining us and has been with us many times as well is Crystal Wilson. We're always delighted to welcome her back as the Assistant Superintendent of Communications and Marketing for DPSCD. But joining us during this segment and the folks who are going to ask the questions of you, Crystal, as well as Yolanda, are three folks that are doing our panel. The first one will be Maria Castellanos, who is from the Detroit Hispanic Development Corporation and the Congress of Communities. Joining Maria will be Latanya Peterson, who is a parent and grandmom, and really so proud to say is from the Detroit Parent Network. Joining Latanya and Maria is one of our youth ambassadors from Detroit Parent Network, Binate Orlu. And I would love it if each one of you who are doing our panel, just take a smidgen of a time, tell us who you are, and then what we'd like to do is for each of your questions, you're going to ask them both of Crystal as well as Yolanda. So we want to make sure that we get an opportunity to hear from you both. This is going to be a substantive conversation. We've got a good solid half hour, but it can go pretty quickly. So we're going to ask both Yolanda as well as Crystal, if you could kind of try to keep your comments anywhere from like that, 1 minute, 2 minutes at the most, so we can begin to have some back and forth with this. And then we'll have some questions, no doubt, from the audience. So those are our parameters. And I am happy to have turn it over now to Maria. Welcome to do the questions of both Yolanda and Crystal to start us off.
Buenas tardes.
Good afternoon.
Mi nombre es María Castellanos. Represento algunas escuelas y dos grupos de aquí de Southwest Detroit.
My name is Maria Castellanos, and I represent the schools and some groups from Southwest Detroit community.
Estoy en Congreso de Comunidades en el grupo de TAN y en DSDC en el grupo Poder de Padres Líderes.
I am at the Congress of Communities group of TAN and at Detroit Congress of Communities.
It's gonna come back.
¿Cuál es el grupo del el DHTC?
Poder.
Poder, group at DHTC.
Ok. Mi primera pregunta es para el panel que dice, ¿cuáles son las 3 cosas principales que la gente debe saber sobre el plan de regreso a las clases en las escuelas?
My first question is to the panel. What are the top 3 things people should know about your back to school plan?
I can actually go first. Hi, I'm Crystal Wilson from Detroit Public Schools Community District. And we plan to continue to follow CDC guidelines. That's very important to our school district. And we are in constant contact with the local health authorities, the state, local officials, and also in constant contact with the CDC. And so we have signed a safe return to plan agreement with DFT, Detroit Federation of Teachers. And essentially, most of the pre-vaccine safety guidelines that were in place will remain in place. The difference is we now have a vaccine, and we will continue to provide access to families to get the vaccine. We will require weekly COVID-19 testing for all of our staff. And with parental consent, we will provide COVID-19 testing for students. And we will work to maintain the highest levels of safety as we did last fall, which helped us to prevent the spread of the virus in schools.
Tengo otra pregunta. ¿Cómo van a ser las inscripciones de los estudiantes? ¿Van a ser nada más en inglés o necesitamos otros idiomas?
My second question is, how is enrollment happening? And are the enrollment documents in languages other than English? We need other languages.
Okay, I'll take that one as well. So starting Monday, we will have pop-up enrollment centers across the city at our various school locations, so families can visit the pop-up enrollment centers. We will also have drop boxes, so families can complete the applications and place them in the drop boxes. We will have the application translated in Spanish and Arabic for families who need it, and other languages as needed, such as Bengali and Hmong.
Great. Can we get, I'm sorry, one moment. Could we get Yolanda, welcome. We wanted to hear your answers to those last couple of questions on behalf of New Paradigm. So if you could talk a little bit about the back to school plan and how enrollment's happening and language, et cetera, that would be great. Thank you so much.
Not a problem. Thank you. I'll transition from my computer that didn't want to show my face to my phone. So I appreciate you guys.
We like your phone. We love seeing you. Thank you.
Thank you. So a couple of things. One, thanks for just having this conversation. I was quite grateful for even what Nurse Hackney has shared, what the city is providing in the support around this health initiative. So thank you very much. So as far as like even with ventilation, we've taken extra measures at New Paradigm for Education for all of our schools. We've upgraded our ventilation systems. Our filters that we're using are equivalent to those that they're using in the hospital. In addition to that, we are doing monthly rotations and changing those filters to ensure safety and quality, and providing ongoing inspections. So we've passed the fresh air cleaning inspection as well as mold analysis. And just talking from the broader perspective, homing into what our families would see one-on-one. We have hand sanitizing stations in each of our classrooms, including in our high traffic areas. We're still going to be doing our ongoing temperature checks, as well as a lot of times people recommend that there's just a need to do deep cleaning once a day. But we have and we will continue to do our deep cleanings at the end of each day, in addition to disinfecting each hour on the hour in those high traffic areas. And this is using our electrostatic sprayers, which does an impactful job of killing any type of bacteria, any variants, any virus within 30 seconds of coming in contact of that. So we are still masking as far as not just our teachers and our staff, but also we will continue masking and asking our students to do that as well on an ongoing basis. You also asked something about enrollment, is that correct? Okay. And so, and if I remember correctly, I heard her ask about the applications being in Spanish. We are offering both in Spanish and as well as in Arabic. In addition to that, we also provide that online support for those families who want to register, where they can, if they don't feel comfortable doing a paper application, they can go to our website and click on it and get that in English and Spanish as well.
Thanks a lot, Yolanda. That caught us up.
No problem. Thank you.
I think, Maria, we can move to your next question.
María, ¿nos quieres decir otra pregunta?
María, yo tengo otro programa, tenía que decir 4, pero ya hablaron un poco de la salud mental y la limpieza de las escuelas. Quiero que...
Voy a traducir eso. She says that some of her questions included mental health and cleaning, and those questions were answered in their responses. And she's moving on to another question.
Okay.
María.
La cuarta pregunta quiere decir que ¿cómo van a hacer para los niños que tienen educación especial, que tienen que ir a la escuela? ¿Cómo los van a tratar?
How will you, her fourth question is, how will you conduct special education this year? How will that be treated?
Crystal, maybe you take that one, and then Yolanda, if you would respond as well.
Yes. So special education, or what we call is exceptional student education, it will continue to be served based upon the student's IEP. And so our ESE community is now hosting family engagement sessions. There was one yesterday, there's one on the 11th, and there's one on the 18th. And you can visit our website, DetroitK12.org, to get your questions answered around ESE.
Yolanda?
And yes, thank you. Our support will continue for our families as well. We realized that last year was not a normal year, and some of our families do not have like a current IEP, a 504 plan, but we're working with them to make sure they get the support that they need for their students, as well as addressing the fact that many of the students were not in buildings across the city, and working with them around the social and emotional learning and some of the additional trauma that some of our families have gone through. So we will continue to serve them and provide those adjustments to the hours to make sure that they get the support that they need. And Jametta, that's also in addition to honoring families. We are providing face-to-face learning, but if there's families that have requested to say that they're still not comfortable with that, we're meeting them in that place as well to provide them with support.
That's really good. And thank you, Crystal. Could you share again, what is the district's term in replacing that one we used to hear all the time, special needs?
Yes, we call it exceptional student education, or ESE.
Okay. And I think that there's one thing that we've learned through COVID. It's really important that we develop a language that is proactive, because our babies, as well as adults, we are hearing so much negatives about our learning losses and other things. It's important to build us up. So speaking of people who help build us up, let's continue to have our parents asking questions. So pleased to have Latanya. If you would go forward your questions, and why don't we kind of reverse it this time? Your first question, Yolanda, if you would answer it, and then Crystal. Latanya, please go ahead.
Good afternoon, everyone. My name is Latanya Peterson. I am a mother of 4 children and a grandmother of 2 children. And my first question is, are you requiring masks for students, and what is the mask policy?
So we are requiring masks. We're going to continue to stay safe, not just for our students, but for their families as well. That's the policy. Latanya, we're all providing those as the students come into the building. So if they don't have them, we are also making that available to them.
Crystal?
Yes, so all staff and students will be required to wear face masks. Our teachers will also have the option while teaching to wear a face shield in the classroom, especially since a lot of the learners look at and view the teacher's mouth for learning. So our teachers have requested that they be able to wear face shields, of course, with social distancing. And we do plan on following the CDC requirements and guidelines, which at this time indicates both individuals who are vaccinated and non-vaccinated should wear a mask when they're inside the building.
Thank you. My next question is, are you offering virtual school as a choice for families?
Yes, we are. New Paradigm for Education will be offering virtual school for all of the families that require or desire to have that, as well as face-to-face.
Crystal?
And I just can say Yolanda and I are in lockstep sync. We will also be offering virtual school option for our students. And Dr. Vitti will have more information on that in upcoming family engagement sessions that will begin next week. So we know that all families aren't ready to go back for face-to-face, and some also may have medical needs. So we're committed to providing that option for our families and to address the learning loss that we know has occurred due to the pandemic.
Okay. I have one more big question. It's like a 3-part question. And it goes, are you requiring school staff to be vaccinated? What are the guidelines that you have for students? What is the protocol if someone tests positive? And most importantly, who want to make sure all these policies are being implemented?
So we know that charters as well as other districts have offered an incentive for their staff to be vaccinated. And we have not mandated that or required it, but there are incentives that have been offered to encourage them to do it. We have not mandated or required for any of our students to be vaccinated, but we have been providing vaccination opportunities at several of our campuses throughout the summer, including ongoing COVID testing, and just making available that information and resource and encouraging people to do it. But there is no mandate on that, Latanya.
Crystal?
Crystal?
That big question. You're on mute?
I did it. I'm on mute. The big question. I appreciate the big question. Exactly what Yolanda said, that we do not require our school staff to be vaccinated. We did offer an incentive that expired June 30th, 2021. We are happy to report that 70% of our staff are fully vaccinated, and we will continue to encourage our students to get vaccinated, those who are eligible. It is not a requirement for students to be vaccinated. And in fact, to be tested, they need parental consent and to be vaccinated. We are requiring our staff to do a weekly COVID-19 test. So that's a requirement, and testing sites will be across schools and at the central office level. And the one thing, protocol for alerting of positive cases, as it stands now, the state still requires the district to report positive cases on the website and keep that updated. So I don't imagine that will change. So we will continue to keep that updated. We notify when we have a full process, when we're notified of a positive case, and we work with the surrounding counties and their health departments to confirm the positive case and to work on contact tracing so that we can identify the individuals who were in contact with the positive person. And then we notify our families and anyone who is involved or in contact with that individual. And according to the health department, they recommend the quarantine time frame and the return back time frame. In terms of how we will implement and monitor this, I'm cheating because this is a lot, but the district and the DFT, our Detroit Federation of Teachers Union, we will continue. We have a joint labor management committee on schools reopening, CSR for short, but they meet weekly to review reopening issues and review pandemic related data to inform any recommendations to leadership regarding the plan. And so this is another layer of monitoring, accountability, and collaboration to make sure that the safety standards are implemented and followed across the school, especially since we have our deep cleaning protocols. We have the charts that are outside of the schools where facilities and operations, they complete those when there's a cleaning. Lastly, I'll say, because we know that some families haven't been in the building for a whole year, we are offering family tours at the schools before school starts so that they can see what it looks like and they can get their questions answered at the school level.
Real quickly, because we need to transition. Go ahead, Yolanda.
I just wanted to add what Crystal, because basically those are the guidelines that all schools need to follow in regards to if there is COVID. I will say this, one of the things that we have really gone out our way to do is not just one case is identified and we notify everybody and that state website, is provide some additional family support for that family to get them through that time. Many times it requires hospitalization, family is covered, and there is just a ripple effect of what takes place once someone has gotten sick. So I just wanted to add that.
Yeah, that's really important. And we're down to like the last 10 minutes of this segment, and we never seem to have enough time, but we absolutely have time to hear a youth voice.
Awesome.
So be Nate, would you come on screen, please, and start your questions, and perhaps start with Crystal Wilson first. Go ahead. Be Nate.
Okay, hi everyone. My name is B. Nathaniel Orlu. I'm the youth ambassador at Detroit Parent Network. Okay, so I will start off with who are the charters using to establish real-time COVID policies?
Repeat it one more time, Nate. Who are the
charter schools using to establish real-time COVID policies?
We're following the CDC guidelines as well as what the state has issued I don't know if you want to be a little bit more detailed about the question.
Okay, no, that was my the answer I was looking for. My next question will be, all of the schools have gotten millions of new dollars. So I wanted to know, can you highlight the top 3 things that those dollars are being spent on?
So the dollars that we have received has been allocated for upgrade systems to ensure that we are going to be compliant, to make sure that our families are safe, again, no matter what the variances is. And I share some of those things around the ventilation and the ongoing maintenance of that, in addition to the support for the social and emotional learning for our families, PD for the staff, as well as providing the additional resources that families will need and the tools that's going to be needed to really fill this gap around learning. When you think about what was lost on the past 15, 16 months of this past COVID year, and even going into the next school year. And some things are still being identified as, and I know many of the other partners that's on this call, every week it seems like we discover something else that this has impacted in our lives, not just in our personal lives, but also the unraveling of what this has cost our youth and our community.
Yeah, absolutely. Crystal?
This is a good question. Thank you, Nate, for being here and staying engaged. There's a couple of buckets that we have very high level that we're allocating the state dollars to. One is bringing students and families back to our schools. So we know it's important, as Yolanda mentioned, to meet families where they are. And so right now we're embarking on a huge initiative where we have a goal to visit every family in the district to make sure that they have resources they need now and as they return to school. We're also prioritizing our young learners with kindergarten boot camp. We know across the nation there was a huge learning loss where families didn't feel comfortable bringing their young learners back to school. So we're working on that. We're re-engaging our students. We're adding community outreach coordinators. We're expanding and deepening transportation, and again, making school fun again by increasing arts, music, and athletics. The other thing that we're doing is maximizing safe face-to-face learning, investing more in safety protocol. We're reducing the class sizes. We're continuing to invest in our employees. They are going to receive hazard pay for teaching in person and blended. And we're also centralizing virtual schools. So it'll be a separate school that our families will opt into versus running it like online school. We're also providing academic interventions. We expanded summer school this year, and we're also intentionally radically improving the high school experience. We have a new head over just the high schools so that we can address the needs of those students. We're also meeting social emotional needs of students. We're expanding our mental health and medical supports. And also we're working harder to cultivate student interests and passions. And the last thing we're doing is improving our capital projects investments. So that's our buildings and our infrastructure. We're announcing a plan in January to the board based upon a couple of studies that have been performed on how we can improve our facilities and learning environments for our students.
Great. Nate, we've got about 4 more minutes for your question and the responses. Go ahead.
Okay, my next question was, how can parents and students get involved to impact the student board policies to ensure that parents and students have a voice?
So we offer parents the opportunity to participate in our school improvement teams, as well as at board meetings. I know we have the voice of parents and students when it comes to even some of the work that we're doing around staying safe in our policies around COVID, just to ensure that we have their voices at the table and rolling out and implementing things as well. We continuously, on an ongoing basis, when there are any things that are going on, before we make major changes. One thing that took place even in this past school year, when we had a lot of the families say that the amount of time that our students, the young learners, were online was overwhelming them. We broke the day up and we changed the schedule based on the fact that we ask and survey our parents on an ongoing basis to make sure that their feedback is incorporated in learning.
That's right. Crystal?
Okay, thank you, Yolanda. This is fun. I haven't worked with Yolanda in a minute. Nate, to your question, we have the School Advisory Council. So there's a SAC at each school, the board established and approved to help inform on decision making at the community and school level. We also have the PTA set up at each of the schools, and we work through our parent advocates and to ensure that they have what they need to support their students in school. And we also have the Student Leadership Council. And so we have young leaders across all of our high schools who help inform and recommend policy. And we also have various task forces that we've initiated, especially during the pandemic, that pertain to online learning. And Dr. Vitti and our leadership team always has an open door to receive special requests or entertain ideas and solutions to problems as they arise. As we know through the pandemic, you don't know what you don't know. This year, we're better off because we did it last year, but there still may be some issues that arise that we just haven't thought through yet.
Okay. So I want to thank number one, both obviously Crystal and Yolanda, our educational leaders, but we had some phenomenal parent leaders and youth leaders. But this conversation, we don't want to stop. So we are asking Crystal and Yolanda, and we'll be asking the new Wayne Risa superintendent as well to come back on August the 26th. You'll be a little bit further up the road and you'll have some more facts and information. And we really want to hear that because we know that parents, not alone children, are getting a little anxious about what does back to school look like. So with that, I want to thank you so much for this segment, and I'm going to hand it back to Christine as we get ready to round out, I think what people believe, a substantive conversation. Thank you. Christine.
I have two questions for Crystal and Yolanda, and they are somewhat yes and no questions. So I want to get them in really quickly. Do children 12 and up have to get vaccinated to go back to school?
We have not mandated that. We encourage, we have provided the opportunity to get campus.
So Yolanda, you're breaking up a little bit, but what I think I heard you say is you're not mandating it, but you're also providing supports to students, vaccination clinics, things of that nature, to make it easy for parents and their students to get vaccinated. And Crystal, you're shaking your head yes?
No, I'm not. I'm agreeing with you.
Yeah,
I'm saying, yeah, I agree. No, we are not mandating anyone, staff or students, to be vaccinated. We are providing vaccine opportunities and access for education and working with our health officials and of course with the city of Detroit, Detroit Health Department with the mobile vaccine units. Access is what we're providing, but it's not required.
Great.
Only testing is required.
Testing will be required, providing access, great. And then will there be hazard pay for school support staff?
Yes.
Yes.
That is currently being negotiated with the other union bargaining groups. So I would say most likely Dr. Vitti said that he would be negotiating those safe return to school LOAs. So more to come on that.
Great.
But
go ahead. Thank you so much, both of you. It is truly a pleasure to have you here today. And like Jametta said, we want to invite you back for for our session on education on the 26th.
Cool.
So I'm going to close us out here, and we want to share with everyone the information about the child tax credit. So I'm not sure if you've heard about it, but we are incredibly lucky this year that our tax credit for our children is being given to families in monthly increments. So, you need to make sure that you sign up with the federal government so that you can access your credit. So you do that either by following your taxes. That's what I'm currently doing, is following my taxes, because I haven't gotten them yet, or trying to at least. File your taxes, or your 2020 taxes, or if you don't normally file, that is okay. You can access the website that you see right here on the screen, and you can follow the links, and you can sign up for the tax credit. You get a credit for each one of your children, and it is somewhere between $200 and $300, depending on the age of your children, for each one every month. So some families could get a credit up to, I believe, $900, $900 a month, depending on the ages of your children. So make sure you access this. Most families need a little extra every month, and this helps you to make sure that you get access to that tax credit, and it'll be monthly. So you'll be able to have that little extra money that you have been looking for every month. I know that I do. So, and if you have any questions, you can reach out to any one of the organizations here. We're more than happy to help you work through the process, because it is an online process. So we'll be happy to do that for you. So thank you all so much for joining us today. We hope that you all have a really wonderful rest of the week. We'll see you back here again next Thursday, same time, same place. Until then, stay healthy, stay strong. We'll see y'all later.
Take care.
And everybody turn on their cameras, because it's a group
Yes,
effort.
let's see these faces. Let's keep Detroit strong. Bless everyone.